We all have rough days, but how do you know when feeling low has become something more serious? Depression is now the leading cause of disability worldwide, affecting nearly 10% of adults in the US alone. But here's what many people don't realize. Depression isn't just prolonged sadness. When you're sad about a bad grade, a breakup, or even a rainy day, those feelings typically pass as circumstances change. Clinical depression, however, is a medical disorder that lingers for at least 2 consecutive weeks and significantly interferes with your ability to work, play, and love. The symptoms go far beyond feeling low. We're talking about symptoms include losing interest in activities, changes in appetite, feelings of worthlessness or guilt, sleeping too much or too little, poor concentration, restlessness or moving slowly, low energy, trouble making decisions, and in severe cases, thoughts of suicide. A clinical diagnosis requires at least 5 of these symptoms, present most of the day, nearly every day, for at least 2 weeks. What makes depression particularly challenging is that it's a genuine medical condition. Brain scans show smaller frontal lobes, disrupted neurotransmitters like serotonin and dopamine, and hormonal imbalances. Depression also affects sleep and hormones, with disrupted circadian rhythms, changes in sleep, high stress hormones, and thyroid imbalances. Causes are complex, involving genes and life experiences, and there is no single test for diagnosis. Treatment often includes medication and therapy to restore brain chemical balance. In severe cases, electroconvulsive therapy or new options like transcranial magnetic stimulation may help. Supporting someone can mean helping with practical tasks, encouraging treatment, and reminding them that seeking help is a sign of strength. It takes an average of over 10 years for someone with a mental illness to seek help. If someone you know is struggling, encourage them to seek treatment and remind them depression is a medical condition, not a character flaw. Sometimes, simply asking about their well-being can make all the difference. Open conversations about mental health don't just reduce stigma, they save lives. The more we talk openly about depression, the more we can encourage people to seek help and improve lives.
Sometimes being a teen feels like carrying the weight of the world. Depression can make every day feel impossible, but you are not alone.